Okay, good evening, everybody. Good evening. Thank you for joining Carl and Joan and I. My name is Dawn H. Jones. I am the Managing Director of Hope Place HR, and I'll be facilitating this meeting. As I suggested, I'll be joined by Joan Myers and Carl Barge. So I've got a few talking points that I just want to cover ahead of the meeting. And we're going to talk about what we'll cover in the meeting, the format, and so forth. So last month, I don't know if any of you were aware, but we've also done a discussion on gaslighting in the workplace. And the reason I mention that is because these two topics mutually complement one another. So if you weren't able to be present at that discussion, I can drop the link in, I'll send a link to you tomorrow, and you can watch the whole of that discussion in your own time. So on the panel tonight, obviously myself, my name's Dawn. As I said, I'm Managing Director of Hope Place HR. So can I start to mute your microphone for a moment?
How do I do that now?
Thank you. And the mission of our agency, our consultancy, is to help people become HR wise. Okay. Is everyone muted? Can I ask everyone to mute? Thank you. So on the panel tonight, we have Joan Myers. A lot of you may know Joan. She's a Queen's nurse. She's also a former assistant director of nursing. She's a Florence Nightingale scholar, and she's a council member on the Royal College of Nursing. We also have Carl Barge, and Carl is a counsellor, psychotherapist, and a clinical supervisor. Now, the three of us are bringing our collective skills to bear on what is a very live, current, and sensitive topic, and we're well aware of that. And our intent is to serve you in a manner that educates, equips, empowers, and encourages all of you as participants. So no, we're not here just to share knowledge for knowledge's sake. We're sharing it as a means of you using it to in your situation as is wise. So I want to first of all say as well that the response to this event has been phenomenal. We had 500 tickets and they all went. So thank you for that. We appreciate you taking the time out to attend. Now, the format of the evening is going to be as follows. So Joan is going to define what we mean by microaggressions, and she'll give some specific examples along with some frameworks that can help you consider how you would address the impact of microaggressions and what your response may be to microaggressions, if any at all. Carl's going to discuss the psychological impact and suggestions for addressing the adverse effects of microaggressions. We're well aware that microaggressions can have an adverse mental health impact, and so we're keen to address that point as well. So after that, I will then talk about some policies from a HR perspective and support that's available to you in the workplace. And then after that, that'll take about 30 or 40 minutes. We're going to open the floor for questions, for discussions, for comments. Please feel free to share your comments or insights. And if you do have a question, can I just ask you that you preface your questions with a capital Q? So when we're going through the chat, we can actually pick out the questions easily. After that, we will open up for, what I will say as well is oftentimes when people are talking about sensitive subjects like microaggressions, gaslighting, or anything like that, sometimes we share personal experiences, which is great, but I would just caution you to ensure that you don't share any personal experiences that may have a detrimental impact on you personally and professionally. So share by all means, but please use wisdom in sharing, because we are in a live and public space. So those are my introductions over and my preamble. Over to you, Joan. You there?
I am here. Good evening, everyone. Thank you so much for that, Dawn. It's really great to be here, to know that there's so many people that wants to know more about microaggressions and microassaults. And it's great to be working with both Dawn and Carl again. Welcome to everyone. I've got a presentation. I'm going to try and if you could allow me to screen share, Dawn, I'll put my slide up if that's okay. Okay. If you put permission to share.
Yeah, there you go. Sorry.
Okay, brilliant, excellent. I tried not to put too many slides on, so hopefully, oops. Something's happening. Is something happening?
It's saying that you started screen sharing.
Oh, all right. Oops, it's going all the wrong. It's going the wrong direction. Let's start at the beginning. Start at the beginning. At the beginning. Yeah.
Superb.
Slowly getting there. Hopefully, I can't see anyone, so I hope you can. Can everybody hear? Everybody can see?
We
Just
can hear you. We
me?
can see you.
Yeah, we can see the slides as well. Thank you.
Fantastic.
Yes,
okay, so my title is Microaggressions and Microassaults, and just to say that although I work with the RCN, the Royal College of Nursing, and the Florence Nightingale Foundation, I've also got my own consultancy where I do mentoring and coaching. So anybody's is interested, I've got my details at the end if you want to get in contact with me afterwards. Let's see if the slides will move along. Microaggressions and microassaults sort of like a new word that we seem to be hearing these days. The old word was another word for racism. We're not immune from having individual, institutional or societal biases associated with race, gender, disability and sexual orientation and the other protected characteristics identified in the Equality Act. These biases are often inherited from our ancestors, institutions and society, but the contemporary form of racism is now known as microaggressions and microassaults, although they're nothing new. Oops, next slide. I'll talk about microaggression. It's a term used for brief and commonplace daily verbal, behavioral, or environmental indignities, whether intentional or unintentional, that communicates hostile, derogatory, or negative, prejudicial slights and insults towards any group, particularly culturally marginalized groups. And in this case, we're talking about race, but it could cover any group. I hope you like my little picture on the side there as well about microaggressions. Yes, I still have malaria from the last time somebody says something stupid but well-intentioned to me, because they can be quite stinging. There's three kinds of microaggressions. There's microassaults, which is verbal attack, name-calling, avoidant behavior, or purposefully discriminatory action. So that's more overt and straightforward. You can see it. But people are not like that. These days, people are very subtle in the way they behave towards Black people in general. There's micro insults, that unconscious insult, demeaning and marginalize person's heritage or identity. And I'll give you examples of that. And there's micro invalidation, communications that exclude, negate, nullify, or marginalize a person's thoughts, feelings, or experiential reality. So as I give these examples, I'm sure will come up into your minds different things that you might have come across or heard or even witnessed or been had happened to you. I can hear some voices in the background, so if people can remember to mute themselves. This is just some examples of racial aggression, microaggressions. You can see the comments there. Where are you from? You might think that's just a straightforward question. Where are you from? But often when people ask that question, they usually answer it in a way as if to say, well, you're not white, you're not from England, so where do you come from? And then they're kind of shocked when you actually say that you are. I remember, sorry, Dawn, I can hear some voices in the background. I don't know if you want to mute everybody.
Okay, we'll do
it. I remember an example when somebody asked me where I was from.
Sorry.
Yeah, now you have to unmute her.
Sorry, that was my fault. You go ahead, Joan. Oh gosh. Where was this?
It's all right. I'm unmuted. You can hear me. Okay. Yeah. I remember when somebody asked me where I was from, and I was just in a funny mood. I said, "Oh, well, I was born in St. Teresa's Hospital in Wimbledon, and I used to be a Womble." And they looked at me and they started laughing. And then we became best friends because they were also born in St. Teresa's Hospital by some fluke, this person. And we became best friends just from that. But it could have gone the other way. And you've got the other points. I won't read them all to you. You can actually see them. I'm sure you've heard many of these comments or some of these comments towards you. I remember somebody asking me if my hair was my own, and they said it in a big meeting. Everybody was. The thing is, I'd been with this person all day. I had my new hairstyle. They'd seen it from in the morning to the evening, and at this big meeting where everybody was present and everybody was telling me how wonderful my hair looked and I looked really nice and I was feeling really, really good. And then this person said to me, out loud in front of them all, "Is that your own hair, Joan?" Now, you might think there's nothing wrong with that. Everybody knew it wasn't my hair because I've got short hair, and that day it was a long hair. It was quite long. I'd crochet braids in my hair. And I looked at her, everybody stopped and they looked at me and they looked at her. And I just looked at her and I said, "Of course it's my hair. I paid for it, didn't I?" And then everybody started laughing and then she looked really, really embarrassed and she shut up after that. So sometimes you need to just put them in their place. Next slide. I'll just, whoops, it won't go. It won't go to the next slide. Let's see if it works this way. Yeah, this slide here is just to give you a brain blast, as it says, of microaggressions, just to explain that it happens in different areas, in different ways, to different people at different times. From a gender point of view, whistling at a woman as she walks past, they're sending a message that this is a sex object. This woman is appearing for the enjoyment of men. That's one type of microaggression. A microassault is an explicit racial derogation meant to hurt, such as calling somebody coloured or oriental, or in the case of the footballers, throwing banana skins at them. Imitating accents. So you're talking to somebody and suddenly they start taking the mickey out of your accent and mocking how you're speaking and what you're saying. Micro invalidations, as I mentioned before, negating the thoughts, feelings or experience of a person of colour, saying, "Don't be so sensitive, you've got a chip on your shoulder." I remember people just say that, "Oh, she's just got a chip on her shoulder," because you speak out about something that's been said or done. Ascription of intelligence, assigning smart based on race or gender. How do you get into that school? I remember somebody saying to me when I started my nurse training, I specialised at Guy's Hospital, and at that time, Guy's and Tommy's were like the top hospitals at the time. I don't know if they still are. Well, they're joined together. They must be still are quite good hospitals. And when I went there were not many black nurses there. And somebody said, "How did you get here? You must have blue eyes." Now, I didn't actually know what that meant, but now I actually know exactly what she meant by that. And then people that make statements like, "You don't sound like a black person." Or I remember going somewhere, I'm giving my own examples, and somebody looked at me and said, "Are you Joan Myers?" I said, "Yes." And they were looking at my name badge. "You sure you're Joan Myers?" I goes, "Well, I am Joan Myers and my name badge says Joan Myers," but they couldn't believe I was Joan Myers because I've been in communication with them over a period of months by telephone and email, but they've never seen me in the flesh. And now at a conference, they meet me. They can't believe it's actually me. I don't know. So, and there's other comments there as well that people say that's signs, they're examples of microaggressions. These forms of biases are often invisible, sometimes unintentional and subtle in nature, and they're usually outside the level of consciousness. And that's why I feel it's important to actually face up to them and do something about it when somebody says something that's not very nice. They create psychological dilemmas for both parties because it represents a clash of racial realities. Sometimes somebody might say something really innocently. Like when I started my training in the 80s, there was a nurse from Ireland, and she was from a small town in Ireland. She'd never ever met a black person in the flesh before. This is in the 80s. She said she only ever saw a black person very rarely on TV, if that. And so she'd never met a black person up front. So literally, and we were in rooms next door to each other. She was a good friend of mine. She used to look at them. She goes, how come the palms of your hands are lighter than the rest of your hands? And then she wanted to touch my hair to see whether, oh, your hair's quite soft, isn't it? And she didn't mean it in a derogatory way. She was just ignorant. I mean, she just didn't know. So that was fine. But there's some people, they're blatant and they're just doing it on purpose just to try and bring you down or to make you feel less than what you are. So microaggressions, they create a hostile, invalidating climate, and it actually saps your energy if it's something that's happening continually, and it results in depression, frustration, anger, rage, loss of self-esteem, anxiety, insomnia, just lack of sleep, just to name a few results of going through these microaggressions and microassaults on a continuous basis. And it is really, really serious. So it needs to be dealt with. And I've just put this pyramid here because when I was doing my study on it, and to realize that it can end with murder. You could get so angry that you end up murdering somebody because of what they said to you or how they treated you over a period of time. Or somebody might commit suicide because they can't cope with it, they can't deal with it anymore. So it goes up in levels. It might start at the bottom with just teasing and telling jokes and works its way up. That's why you should be really careful of all the teasing and the joking and all the stuff that happens. They call it banter in the workplace. To one person, it might be banter. To somebody else, it might be really, really serious. And then putting people down and intimidating them. You have to call these things out. You cannot allow them to continue. And that's why people get to the stage where they commit suicide or even want to murder somebody. And we don't want to be getting to that level. So I think one of the problems with microaggressions and microassaults is sometimes when it happens, you could be in a state of shock, like, did that really happen? Did she actually say that to me? Or did he actually do that? And so you have to determine whether the microaggression actually occurred. So you're questioning yourself. I remember the first time it happened to me, I said, did she just say that to me? No, she never said that to me. And I thought, let me just let it slide. Maybe I just thought she said it, or I thought she meant what I thought she said. And another time I asked somebody else about it because somebody else was in the room and they kind of just, oh, don't worry about her. It's no problem. So don't worry about it. That's just the way she is. And then after a while, I realized that this is the way that person was, but it doesn't mean it was the right thing to do. How you react can be a challenge because you could be told that you're an angry black woman or angry black man as a result of the way you responded. So that's why you have to, what I often do is go away, think about it. I'll talk that through later and then decide how to respond rather than just reacting straight away. Sometimes you can be labeled as oversensitive. I remember being told, Joan, you're just too emotional. You need to learn how to manage your emotions. Or somebody will say, stop being so paranoid. It's not that bad. And they'll just try and downplay what just happened to you or how you feel. But you know your feelings and you know how it impacted on you. So as a result of did it really happen and you're not sure what to do, sometimes some people do nothing, but the anger and resentment builds up over time and it could really damage you. I spoke to somebody yesterday. For the last 3 months, she's been putting up with this. From the time she started her new job, she's been putting up with it. And now it's getting so much where she just decided to leave. But she realized there's a pattern. Every time this sort of behavior happens in the workplace, she would just hand in her notice and leave and get another job. But she realized that she needs to stop doing that because she's not dealing with it. So she's asking me, what do I do? How do I deal with it? So you need to be able to know how to deal with it. Doing nothing because you don't know how to respond is not a good option either, because as I said, it will build up. And sometimes you might rationalize it. There's no point of responding because things won't change or it may get worse, but you never know. As I mentioned at the beginning, it could be an unconscious thing that this person done or said and did and didn't realize until you bring it to their attention. And when I've brought things to people's attention, they're kind of, really, I didn't realize it'd have that impact on you. I didn't mean it. I'm really, really sorry. And they go into this great big apology thing, or the sensible ones do, or they might go into the other way and say, come on now, sort yourself out, stop being so sensitive. I didn't mean it like that. So it depends. So you have to know, you have to have a strategy for dealing with it. Or you could be like somebody that I know that they say, oh, they want to rescue the person that's doing it. Oh, don't worry about her. That's just the way she is. Or those people, they're like that all the time. I remember the worst racist comment I ever had. when somebody pointed me out in the room and said, it was me and this other person, said, I want to speak to those two afros over there. Well, for a start, I didn't have afro hair. So I looked around thinking, who's that? Who's he talking about? And it was me and the other black person in the room. Were we the only two black people in the room? And when I said to her, did you hear what he just said to us? Don't worry about him, he's a racist. They're all racist anyway, don't worry about them. And then she didn't want to talk about it anymore. But I wanted to talk about it and I wanted to deal with it. And I did deal with it. Nearly finished. So you need to have some tips and tools to deal with it. You do need to face up to it. You do need to confront it. And it does need to be dealt with. Because if you don't, it will just fester and continue. I found this thing called the 4 Fs. You have to, what were the facts? What were your feelings? What was what were your findings? And what future do you want to do as a result? But this one, I found this one is called, it's called Open the Front Door. I like that. Open the front door. Anyway, open the front door, the acronym for open the front door. What did you observe? So when that person said what they said or did what they did to you, what was it did you observe? What did you think? How did you feel? And what is the desired outcome? Because that's another important thing. There's no point saying they did this to me. What do you want to happen as a result? So state in clear, unambiguous language what you see happening. Have the facts. What did you actually see happening? Write it. It's best to go away, write it down. Go and talk to somebody. Either you write it down or go and talk to somebody about it. What did you actually see happening? And then express what did you think or what do you imagine the others were thinking when they said what they said. Be very clear about that. And then express how you feel. When they said that, it made me feel angry. So it made me feel angry, it made me feel frustrated, or it really felt demeaning, I felt embarrassed. Say how you felt, and then state what you'd like to happen as your desired outcome. So I'll just give you one example. I was at work one day and one of my team members, we only had 2 cars between us. I was a community nurse, 2 cars between us, and the cars were booked out and I was booked to have one of these cars to use to visit my patients. And she said to the whole team, I don't even know why Jo needs the car anyway. It's only 10 minutes away and she always gets lost anyhow and she never knows where she's going. And then she started laughing. It's true, I've got no sense of direction, but that's not the point. And so they were all laughing together and I looked at her and I looked at them and I thought, yeah, just continue, I'll sort you out later. So I didn't say anything to her. But the next day, I took her up to the side on her own and I said to her, I didn't like what you said about me in front of my team. I found it disrespectful, undermining, and it wasn't called for, and I was offended by what you said. And she goes, oh, I was only joking, Joan. I goes, did you see me laughing? I wasn't laughing and I didn't find it a joke. And I was very upset about the way you spoke to me because that's putting me down in front of my staff, giving them the wrong perception of me. And straight away she did the thing, and I call it white tears. You might have heard of it before. White people, for some reason, when you face up to them and confront them with the issue, not all of them, I'm just saying it. This is what I found in my experience. I'm not saying all people do that or all white people do that, but that's my experience. They like to flip it the other way. So she started crying. I'm so sorry, I didn't mean it. It wasn't all that business. I just gave her one handkerchief, a tissue. I gave her one tissue. I said, there's no need to cry. I'm just telling you how I felt when you said what you said. Please don't do it again. So I stated what I'd like to happen. The desired outcome is don't do it again. And she said, okay. And she apologized. And I said, thank you. And that was it. And I left the room and she never did do it again. And we became best friends. And I've actually noticed people that I actually confront about their behavior and tell them about behavior, they usually end up fine, sorted. They sort themselves out. So that's it. Thank you for your attention. Any questions? And I've got my details there if you want to get in contact with me afterwards. I know that was just a whistle-top tour, but I'm sure that Carl and Dawn would add more to what I've said. Thank you very much. I'll just stop screen sharing now.
Thank you, Joan. Carl, if you can get ready. In the meantime, Joan, thanks for the examples, defining what microaggressions are, the examples, the consequences, and a practical framework for dealing with the situation, because oftentimes people don't even have a label to put to what they're going through. They question themselves, but to actually have it laid out so clearly with some clear examples and with a framework to actually thinking through the impact on themselves and potentially what they will do going forward is absolutely awesome. So thank you very much.
Thank you.
Thank you. Carl, you there?
Yes, I am. I'm here.
Okay.
I'm ready.
Okay, do you want to go ahead?
Yep. You let me share.
Yeah. Superb. Thank you.
Sorry, Dawn, somebody's still got the mic on.
Okay, bear with us. Okay. Go ahead, Carl.
All right.
Thank you.
Okay. Good evening, everyone. Good evening. Welcome. Wide. So as you can see, we do have a bit of an overlap. I think that Joan, thank you once again. You did an amazing job in the overview. I think some of what you've discussed and what I'm going to cover, it's one and the same, but there are some different caveats that I have raised that I hope everyone can glean something from what I'm going to share. Okay, so it's all about what is your experience, I feel. What is your experience? So as I go into this, I want you to think from your frame of reference. I've seen some of the comments in the chat, and we know that as Joan mentioned, it's another name. It's a topical name for what is happening in the world today. Your microaggressions, your micro assaults, your micro insults, your micro invalidations. So we'll go in and get some further understanding of what it means. So when we think about the microaggressions, and from the previous slide, we get an idea and a glimpse of how subtle microaggressions can be. However, when they become persistent, problematic, and pervasive, they tend to affect our mental health in ways that affect the very fabric of our being. Due to the nature of microaggressions, people may feel they don't have a voice due to the nature of what has been said to them and the perceived authority that the person may have. As a result, studies have shown that people of color who have experienced episodes of microaggressions in the workplace have reported higher levels of depression, generalized anxiety disorders, social anxiety, and other mental health issues. So what's the impact? A professor noted, and I think this is so key. Sometimes it's the 1,000 little cuts that hurt our mental health the most. 1,000 little cuts. So as I noted in the chat, someone mentioned that they're going through that process right now, and another person mentioned that they're in the midst, or they're contemplating leaving their job as we go through this presentation this evening. And that's how it affects us. It's the 1,000 little cuts that could be on a daily basis. Oftentimes, this is played out in the questioning of self. So, as Joan said, did I truly hear what I thought I heard? This experience is not uncommon when dealing with racial microaggressions. We have topical examples which abound, such as the black college student who was asked by her white counterpart if she lived in the dorm building, but didn't believe that she did and called the police. We have the story of the two black men in a Starbucks a couple of years ago who were arrested for trespassing when the store manager called the police because they refused to buy anything. One bystander stated she had been there for hours, and hadn't bought anything. And finally, we have Amy Cooper and Christian Cooper, no relation. It's the story, if you're not aware, I'm sure it's something that went viral, but if you're not aware, it happened in Central Park in New York. It was a demonstration of a topic, as people of color know and understand, could have turned out totally different if Mr. Cooper didn't have the evidence to show the sheer lunacy of the event. She didn't call the police once. She called them twice. She called them twice, and she upped the ante on the second call. So what is this? What's this impact? So defined by a Harvard psychiatrist as brief and commonplace, the daily verbal, behavioral, or environmental indignities, whether intentional or unintentional. I think that's the key part as well. They can very well be intentional, and oftentimes they are unintentional. But the thing is, it is around how we're able to educate, educate people, psychoeducate people. It's also how they communicate hostility. It can be derogatory. It is the negative racial slights and insults towards people of color. Microaggressions contribute to an onslaught of injuries to the psyche that may seem unrelenting and can result in everything from depression, fatigue, anger, rage, physical ailments, such as chronic infections, thyroid problems, type 2 diabetes, and high blood pressure. It is the thing of people going to the doctor and going to the doctor several times, and the doctor is unable to find any type of malady wrong with the individual because it is something that affects, as I began, it it affects the very fabric of our being. It's an external and internal response is necessary to microaggressions. Why? Because it's a significant coping mechanism to employ when faced with racial microaggressions. We must become aware of how to respond to microaggression in whichever setting we are faced with them. We must seek support from people who can help us to process the explicit and the implicit aspects of our experiences. The explicit is the thing that you can see. It is the overt. The implicit is what is hidden. We can't see it. It is covert. So you do this by you seek out, you search out your colleagues, a therapist, a coach. It can be pastoral, family members, or friends. It is paramount that a safe space can be sought to share what is happening to you. So now we have, and this is, and I think when I think of this flight, fight, or freeze scenario, is when we think about the examples that Joan has given, the examples that I'm about to give you this evening, is that a lot of times we don't want to deal with it. Again, as I noticed in the chat, it's every day because we have to deal with it every day. It is that internal response sometimes is, let me take flight. Let me not just bother with this today because I don't have the energy. I don't have the wherewithal. I just don't have it within me to really deal with this today. And so we go a little further and we say, well, how can I respond to microaggression? What are you supposed to do when you're a victim of a microaggression? Well, as I like to talk a lot about, it is, we have this drama triangle, and within this drama triangle, we have the victim, we have a persecutor, and we also have a rescuer. The only way that you can remain out of that drama triangle is if you don't enter it. But the thing is, when people from the outside and they are the ones who are committing these microaggressions, it is how you're able to see it for what it is and respond in a way in kind. So, in an article on racial microaggressions, Dr. Daryl Wing Su, he is the person who coined the phrase microaggressions, and his colleagues, they discussed the catch-22 that people experience when they witness or are recipients of microaggressions. First, the individual may question if a microaggression has really occurred. So, i.e., did I hear him correctly when he made that comment? Next, the individual decides whether or not to take action. If the individual does respond, there's a likely outcome. For example, we know what's going to happen. There will be arguments, there will be the defensiveness, the denials or additional microaggressions. As Joan mentioned earlier, you have that white fragility at times where the tears will come. If the individual does not respond, there's also another outcome. For example, the regret, the resentment, the sadness. Thus, the process of deciding how to respond to a microaggression can be stressful in itself. So when you consider that if I don't respond, then you have that internal dialogue of, why didn't I say anything? What's wrong with me? You start to, it's that, it affects your self-esteem, your self-worth. Your ideal self starts to suffer as a result because you don't feel like, so as a man, am I not a man? Am I not woman enough to stand up to something that is egregious? Another doctor here, Dr. Kevin Nadal, he researched, developed, and describes a three-step process that can be undertaken, which assists with an individual with how to react to a microaggression by asking him or herself the following. So, did this microaggression really occur? Should I respond to this microaggression? And then how should I respond to this microaggression? Because these are key. They're key questions to ask yourself. They're very key. And they're key because we have choices. We have choices in this. Did this microaggression really occur? So sometimes microaggressions can be identified effortlessly. For instance, when a man of color notices that a white woman clutches her purse as he enters an elevator or walking down the street, he may be able to identify this as a microaggression immediately. And I, in the spirit of self-disclosure, this has happened to me a few times. And in my life. And I'm sure that the assumption of my being a criminal was real and alive in their minds. So similarly, if a co-worker makes a similarly racist comment in front of a black colleague, the recipient might question whether he or she heard the statement correctly. When there are people around, particularly people who the individual trusts to verify and validate the microaggressions, it makes it easier for the individual to definitively label the event as a microaggression. When there's no one around, it may be helpful to seek support from those who you have built a working alliance with that can listen and hold what has been shared. We know and we can see that technology is a useful medium today to share experiences of microaggressions as well. From the example shared earlier, we have Twitter, Instagram, Facebook, etc., which have highlighted everyday people going about their business only to be accosted. Unfortunately, it can lead to devastating circumstances for those who participate in this behavior. In August, we had the gentleman on the tube who stated, "This is my home. You're all going back," before exclaiming, "You're black," singing, "They are lesser than us, they are lesser than us," when one of the group demands his name. And we saw, if you didn't have the opportunity to see it, upon exiting the carriage, one of the teenagers turned around and knocked the man out. We know from experiences that this could have turned out so much worse for the young man if the person in question had died as a result of his injuries. So, just to follow up on that, so just thinking of, when, the questions that you have to ask yourself in how you respond, because sometimes when you respond, you are made the bad guy. So that's why it's, we have this thing within, working it within the prison estate, If you didn't document it, it didn't happen. So that's why it's important that you record conversations, you document everything, especially when you're in this type of situation involving microaggressions, micro insults, micro invalidations. You must document these things, or it didn't happen. They will say, as Joan said, that's just the way I am. You know, some have been known in my experience. That's just the way I am. You know, like it or lump it in that particular tone, in that particular way. So how should I respond? Should I respond to this microaggression? If an individual is certain, or even moderately certain, that a microaggression did in fact occur, she or he has to ponder the potential risks or consequences of responding or not responding. So some of the questions. If I respond, could my physical danger or physical safety be in danger? If I respond, will the person become defensive? And will this lead to an argument? If I respond, how will this affect my relationship with this person? You know, e.g. co-worker, family member, etc. If I don't respond, will I regret not saying something? If I don't respond, does that convey that I accept the behavior or statement? And that's a key one as well. Because sometimes if we are not able to find our voice, if our voices are lost, then very often we are complicit in the behavior. Last slide. So if individuals do decide to take action, they must contemplate how to react. First, they can approach the situation in a passive aggressive way. For instance, perhaps the victims make a joke or a sarcastic comment as a way of communicating that they are upset or annoyed. Perhaps the victims respond by rolling their eyes or sighing. Or they do nothing in that moment and decide to talk to others about it first in the hopes that it will get back to the perpetrator. Second, victims can react in a proactive way. This might be effective when the victim simply does not have the energy to engage the perpetrator in a discussion. Sometimes individuals who experience microaggressions regularly may feel so agitated, they just want to yell back. For some individuals, an active response may be a therapeutic way of releasing years of accumulated anger and frustration. Finally, an individual may act in an assertive way. This may include calmly addressing the perpetrator about how it made him or her feel. This may consist of educating the perpetrator, describing what was offensive about the microaggression. Oftentimes, the perpetrator will become defensive, which may lead to further microaggressions, particularly micro invalidations. It may be important to use I statements. For example, I felt hurt when you said that, instead of attacking statements. For example, you're a racist. It also may be important to address the behavior and not the perpetrator. What this means is that instead of calling the perpetrator a racist, it may be best to say that the behavior he or she engaged in was racially charged and offensive. We know people don't like being called a racist. They don't like being called what they are, a racist, a sexist, or a homophobe. So if you want to have an effective dialogue with a person without being defensive, it may be best to avoid using such language. Thank you very much for listening.
Thank you, Carl. Thank you very much. So thank you for going through the psychological impact, the flight, fight, or freeze model, the experience of microaggression, and particularly around the mental health and psychological impact, because that's so important that people are being wounded psychologically. And it's one thing if you know you're wounded, and it's worse if you don't. As well as the internal and external response and coping mechanisms, and the dilemma of responding, to respond or not to respond. and whether or not you exercise your choice to respond or not. And on that note, we've got a couple of questions on that very point, questions around the themes of, should I respond or should I not respond? And we'll pick those up in a minute. But just before we go to questions, I just wanted to briefly say that obviously when people are in a difficult space in terms of how they're being treated, mistreated, whether or not it ultimately amounts to microaggressions or not, there is support available to you within the workplace. Now, most of the participants on here from the private sector, be that education or health, and your organisations should have employee assistance schemes. Now, these schemes are set up as a free employee benefit. It's a confidential service that's normally brought in, contracted by your organisations, or it can be in-house, but it's typically brought in, and you can approach them to discuss any concerns that you've got with work, actually any concerns that you've got with life. And generally speaking, those sessions offer you 6 to 8 free counselling sessions, and you don't need to go through your manager, you don't need to go through occupational health. You can approach them directly. All you need is their contact details, and what you say to them is confidential, and they can also give you health and well-being advice. So that may be a resource to people if you're in that space and you don't feel that you have anybody to turn to, and you need some help and support to help you to deal with it and an impact on you. The other thing is you may feel that your health has been so adversely affected that you can request a referral to occupational health, or you can go and see your GP. Some organisations help you to self-refer, but other organisations, you have to go through either the HR department or your manager, and clearly if you don't want any of those, either a member of the HR team or your manager to know that you want to address a particular difficulty, that may not be the route you want to go. So you can go either the employee assistance scheme or your GP. And obviously there are formal routes that you can take, or formal and informal routes through policies and procedures. So, the bullying harassment policy and the grievance policy. And I'm acutely aware that a lot of people don't want to go down that route because for whatever reason, it's too much. And I'm not saying it's an easy route, but sometimes it's a necessary one. But only you can determine and exercise your choices whether or not you raise the issue formally or you don't do anything. But the reality is, if you don't do anything, the reality is you're actually opting for whatever behaviour that person is displaying towards you. So there's policies, there's the employee assistance scheme, there's occupational health, and as Carl said, coach, mentor, trusted friend or advisor. And the key thing is whatever route you choose to address your issue, please do not sit there in silence. Do not, don't become part of the problem and collude with what's going on because you choose not to do something about it. You're valuable, you're important, you should be treated well. So make sure that even if somebody else isn't treating you well, make sure that you take up the banner for treating yourself well. So in terms of sources of support, we can pick them up in questions. And that is the stage that we're going to move to now. We're going to move to questions, comments and insight for the next 30 or 35 minutes. And really we're opening the floor to you for your questions. So towards the end of your presentation, Carl, or just before then, I had a few similar questions, and they were, is it worth responding? Sorry. Is it worth responding? Will anything change? I suppose I'll go with that one. Is it worth responding? Will anything change?
I think as you just gave a brief synopsis of what it is that we can do, the steps to take. Yeah, as you rightly said, if you suffer in silence, then it will never go away. It will deepen in its presentation, and that's when it starts to affect your mental health. And when it starts to affect your mental health, you are no good to yourself or anyone else in that, for that matter. So I would say especially if you are working in an organization, whereas you are, say, for example, you are middle management, and it's a senior manager is the one who is participating in this type behavior. As you rightly say in in HR, Dawn, is that if you don't know, you have to get to know.
Yeah.
You have to know your HR policies.
Yeah.
If you don't know your HR policies, then you will struggle. You have to use their policies, their own policies against them. Know them better than they do. You have to be able to quote those numbers to them in order to get what you need. Because unless you challenge it, it will remain the same.
Yeah.
This is what we know throughout history. It is nothing changes without struggle. Nothing changes the status quo unless you push through what is being presented to you.
Yeah, absolutely. And on that point, I have found that whether I'm working with organizations or I'm working with individuals, one of the stumbling blocks is that people don't read the policy and the process. And, people say, I haven't got time, or do you know what I mean? I'm too pressed, I've got other things to do. Well, it's really not an excuse, especially if you find yourself bang smack middle in the process. So I can't emphasize how important it is to make sure that you read your disciplinary, grievance and sickness policy. If you read only those three, you stand yourself in better stead than not reading anything at all. So the next question is, Joan, do you want to take this one? It's something along similar lines. Can everyone hear me?
I can hear you. We can hear you.
Someone wants to know, if you aggress, is it better to aggress the microaggressions as they happen rather than let them build up? And would this be more effective and hopefully reduce a potentially negative reaction?
That's a really good question, because I personally like to, as my sister always says, stop it before it starts. So I would, if it occurs and I see it and I recognize it, then I will address it straight away, depending on who the person is. So if it's a senior person to me, like my manager or somebody, the chief exec, then I will wait till after the meeting and take them aside and speak to them about how I felt when they said what they said. And a good thing about dealing with it after the event is that you're able to be very clear about what the issue is you want to talk to them about. So you can say, this is when you said this to me, this is how it made me feel. And as a result, I want to let you know that I was really upset about it. And then they could deal with what you're saying. But if you go all guns ho, how dare you speak to me about that? Why are you being so rude? Because that's sort of sometimes, but in the emotion of it all, there's more emotion and it's very irrational. And then they don't even know what's going on because they sometimes might not even realize that they've said or done something wrong. So it depends on the context, the person, the level, the hierarchy. Sometimes you might need to go away, talk it through with somebody, and to help for that person to help give you the right words to speak so that you can go back to say it to the person. So the first time, for example, when it happened to me, I went to my coach and I said, guess what happened to me? They did this. And she goes, oh, that's called the science of avoidance. That's what she called it. And she said, this is what you need to do when it happens again. And she was able to talk me through so that when it did happen again, I took the person aside and I told them, and I said, please don't let it happen again, because this is the second time. And in other cases, depending on what it is, I just deal with it head on. So it depends. It depends on the circumstance, the person, and timing and stuff. Yeah.
Okay. And another question to that point that I've got written down here is, would you recommend that I think this is the aggressor, the person doing the microaggressions, or meet with a white colleague. So, you know, the person that's on the receiving end and the person that's perpetrating meet with a colleague, and should there also be a witness? Well, we'll answer that.
Well, that also depends as well, because it depends on who the person is. You might not want to be in the room on your own with them, but it might, or you might feel strong enough to be able to sort of speak to them. If you know the person's character and what they're like, that will determine whether you want to address them directly. I think sometimes it depends on who the person is.
Yeah.
And who you are. I for one, I'm an upfront person. I just tell people as it is. But other people are not like that. They might find it a bit more challenging.
Yeah.
Yeah.
And I think that what might be useful if somebody talks to someone, a trusted individual, about that issue, and then perhaps they can coach them through a conversation, and then that person can then be empowered to actually address it. But I think if the individual is in genuine fear of their own safety, then you need to speak to somebody that's much more senior than the perpetrator and discuss a way forward. So possibly a senior manager could sit in on the meeting in that instance. So I do agree. I think it's a depends.
And then from a nursing point of view, we have the Gibbs cycle of reflection, or the John cycle of reflection, or I've just given you the open the door framework, or the 4Fs tool. You can actually use that to write it down, so you've got it very clear and rational in your mind. You can get all the emotion out of it, so you're very clear. So you can take that away and do that first, and then ask to meet with that person at an appropriate time. Yeah.
Thanks, Joe. A question for Carl. So this is a question. I understand that this training is about what we can do as people of colour to respond to racism and microaggressions, but this seems to put the responsibility with this person to manage a racist person's emotions in a way that they can handle. How can we focus on training the perpetrators of microaggressions on responding in a better way when called out?
That is a very good question, and I think that here's the thing. I as a lecturer of counseling and psychotherapy, I educate students on issues of difference and diversity as they go through their training, because they will undoubtedly, we know that the counseling and psychotherapy world is predominantly Caucasian. So they will undoubtedly come face to face with the person of color when they come to sit down with them. Now, I take them through their paces in relation to how to bring it into the counseling work, that issue of difference, because for some they never would have sat down to have a conversation with a Black person, or someone from a different background. So my answer to the question is that it has to come from the white individual, the dominant culture, for them to educate themselves. It is not our problem. The thing is, we're making this. The thing is, it's good to be empowered and to know what's in front of you, so that to know what's behind you, so that you can know that you can move forward with something. I believe that it sits very much in their camp. The thing is, I'm tired of being that case study. We don't need to be a case study for them any longer. I think it sits with them to educate themselves, because we found through the years that these diversity programs that they do within these large organizations, they don't work, because the behavior is allowed to continue. They are very much tick box exercises that I've found. So until someone, and I think within the training that I provide on my courses, that it is something that challenges them. There's an educator in America called Dr. Janet Holmes. She does a white identity model training, which really, and she does a Black one as well, but it really challenges white people to really identify, because you never ask a white person doesn't really identify with their whiteness, because they never have to. So as a consequence of not having to deal with it, why do you think that as soon as someone mentions white privilege, they balk at that term? They don't like that term because then they have to look at themselves. They have to look at who they are. And that's the thing, in their everyday walk of life, they don't have to look at who they are because they are the dominant culture. So for me, I don't want to be your case study anymore. I refuse to be your case study. It is down to you to educate yourself. Now, if you want me to educate you, you're not going to like it because, as Joan has highlighted, I'm going to be real and tell you what it's like. This is how it goes. So I hope that I was able to answer the question in some way, shape, or form.
Okay, thank you, Carl.
Can I just add because there's quite a few white people on the talk, which is really great because they're learning as well and they mostly have answers that they can give. But often getting a white ally on your side, because often these things happen as you being the only black person in the room or one of very few black people in the room in the space of all white people, and some of them are seeing the behaviors. And I know of somebody that was on a constant basis being really assaulted by her manager, the things that she was saying to her, putting her down. And it was the white PA who saw and heard what was going on all the time that took the black person aside and said, if you want support, I'm here to support you. I'm willing to write a statement if you want me to. Because she knew she could see what was going on and she could see everybody was turning a blind eye and she didn't have it in their consciousness to allow it to go on any longer. And I believe lots of white people see it and they need to call it out because actually often if the white person picks up for you, it helps a lot more because sometimes a white person will hear what a white person has to say because they're saying it in the way that they can actually receive it rather than the way the black person would say it. Yeah. That's what I've found in practice.
And Giles, you put a question in talking about should we be far more prescriptive about what is and what isn't acceptable behaviour, and I hope that the responses from Carl and Joan have answered your question. If it hasn't, please just pop what you would like to know in the chat. Okay, Joan, what are your thoughts on organisational silence on subjects related to BAME issues and experiences?
What is my views? Thoughts on organisational silence on
subjects related to BAME issues and experiences?
Well, it just shows that that's not a well-led organisation, is it? Because they're actually making out that some of the workforce is not as important as others. So you're not important, so we're not even going to listen. So that is like gaslighting, isn't it? Yeah. It never happened. We're not addressing it. We're not interested. That's your issue. And they're putting it back on the black person rather than saying this is an organisational wide issue, because often there's more than just one black person that's sort of speaking up about issues. And I think what organisations need to do is just, my friend Edith always says, I don't know who coined the phrase, they need to become comfortable with the uncomfortable and sit into the uncomfortable room where the proverbial white elephant is and speak out exactly what they're going through, what they're feeling. And so it needs to be addressed. It cannot be allowed to continue. It's been going on for too long and now it's bubbling up and it's exploding and it's not very nice. So it has to be dealt with. You can't pretend it's not happening any longer.
And I think there's something about when people have been transgressed against and they genuinely believe that, they're wanting some kind of response, some kind of genuine response to that. The reality is there will be occasions when that response is not going to be forthcoming for whatever reason. And I think that you've got to be clear about your responsibility to bring your concerns constructively to the right person, but you cannot be responsible for the reaction. So in other words, you can say, at least at least I've taken steps to address my concerns with you, and you cannot now say that you did not know. I think it's really important that people realise that in life, and it's not just a workplace, but in life, generally speaking, that you're not always going to get a response, but it's still your responsibility to bring your concerns forward in a constructive way.
I think, can I just mention something? Because Carl mentioned about the white person not understanding the black experience. I remember I had a white executive coach, and when I had a blatant racist thing happen to me, it was so blatant you couldn't deny it. It was blatant. It wasn't micro, it was macro. And when I told him, he basically put it back to me. So why do you feel like that? Why do you think they were being racist? I goes, well, they talked about black, they talked about my hair, they said this about black people. He said, well, what's wrong with that? Why are you getting upset? How do you feel about it? Why do you? And then he started interrogating me till in the end, it was like it was all my fault. And that's what sometimes happen. They flip it the other way and they blame you for feeling the way you're feeling. Why did you feel like that? Because he said that to you. And so it is very challenging. And so I've seen somebody saying the chat about the white allies. There are some white allies around, and some of them are really, really helpful. There's others that haven't got a clue, and they're not really helpful. And that's why I say when it comes to psychological support, sometimes black people need a black psychologist, a black psychotherapist, a black coach. And I've been on leadership programs where I've said, so why is everybody white? All the coaches are white, and all of a sudden the black leadership program are all black. You need to have somebody that understands your lived experience that can support you and help you through.
Thanks, Joan. That's that agrees with what I put in the chat. Carl, can microaggressions be part of a manipulative behaviour towards junior staff with less experience? And how can junior staff respond to a senior with this kind of behaviour?
I think we have some rich examples from Joan this evening. It is about if you can find your voice and you can challenge the behavior. I go with what I tell students. It's called CSI. And it's not the program. CSI stands for challenge, silence, and immediacy. The challenge, you challenge the individual, by how
Sorry, somebody's got their mic on. Guest, the person that's called guest, they've got their mic on.
Yes. So guest, can you mute, please?
Everybody else muted.
No. So the challenge. Thank you. The challenge comes when you're able to, if you've been able to step out of the situation, gather your thoughts, organize your thoughts, and then go back to that person and challenge them. And then it's silence, because I think if both of us are talking, nobody's listening. So when there's silence, you're able to listen, and then you're able to reflectively listen. You're looking at that person's body language. You're looking at those nonverbal cues, so that you can respond in kind. And then the immediacy is here and now, because when you can respond in the here and now, that is when change can be effective. Because then we're not allowing for the day, the second day, the week, the month, for this repeated pattern of relating to continue to happen.
Thanks, Carl. Marlene wants to know if she can have our thoughts on unconscious bias training, which she believes often is a tick box exercise. What is the purpose of this, particularly if this can not be measured? And how can we measure change in ingrained behaviour?
If I could just go first, the unconscious bias, when it first came out, I thought it was absolutely brilliant. But then what I realized, it's unconscious until it becomes conscious. So once you become conscious that you've got an unconscious bias, it has to be a continual thing of facing up to it and dealing with it. But I don't think that people do that. It's a tick box exercise. You go in. I did training for all the senior professional officers in the Department of Health, and they were all, wow, we've never heard it and seen it like this before. And it was all exciting at that particular point, how many years ago, but the behavior still continued. It was just like a revelation. It was like, wow, that's good. I never realized that I was had unconscious bias towards people that wore trousers every day or black trousers every day. I'm just using that as an example. And then after that, they forget about it. And that's the end of the story. So unconscious bias, I don't believe, sorts a problem out. It's unconscious until it becomes conscious. And when it's conscious, you need to do something about it on a constant, regular basis, not on a one-off basis.
And I agree. I think that unconscious bias, there's limitations to it. I think that if it's part of a integrated and consistent menu of strategies to address equality, then I think it has its place. But, you know, if it's taken out of context, it can become a tick box exercise, and ultimately it can be more detrimental because people actually lose confidence in the organisation and leadership that anything will ultimately be done. Someone's put in here, please do, people do not have confidence in HR policies, and the equality impact assessment in reviewing outcome of proceedings is woeful in some organisations. Well, Joan and I had this conversation on a regular basis. Listen, HR policies are factual, right? If they're well written, they are factual. It's how people apply them or disapply them, okay? And in order for somebody to be in a position where they can hold their organisation or hold a process to account and make sure that due process has ensued, they have to be prepared to read the policy and be able to say where they think the policy hasn't been followed. So, for example, if you feel the policy hasn't been followed in that particular area, you can then go to that manager, that investigator, or whoever may be leading the process and say, can you help me to understand why the policy says X and yet this doesn't appear to have been done? And then follow up your queries in writing. But really, it's not about confidence in the HR policies. I would say it's more about confidence in the individual and the ability and the extent to which they will hold that organisation to account under their own policies and procedures that have gone through agreed processes, often with staff side and with exec level sign off. So yeah, get to know your policies and procedures.
And I've found policies to really, really work. For those people that are operating with integrity, if you could say the policy says on page 3, section 6.3, it says this, this, and this, but in this organisation, that, and that is happening. Could you explain to me why this doesn't apply to my situation? However, it seems to apply to everybody else's situation. Then they have to be able to answer that question.
We've got a question here is, what advice would you give to your white colleague friends if they witness the conversations which they feel are unacceptable amongst white colleague friends? When I've done that in the past, I've been told you're taking it too far, which I find really difficult to challenge further.
My example is that if they remain, it's like, you know, modern day, you know, from back in the day.
Okay, she's muted.
Okay. You know, when the white footballers from back in the day, they didn't say anything. They were just as complicit as those who were the perpetrators. So if you don't say anything, the question you have to ask, you have to question yourself. You have to ask yourself the question: am I complicit in this? Because if you feel it within, if you feel it within that it's wrong, and you remain quiet, and you understand that you have that privilege, because you will be listened to, you will be heard, because a lot of times you have that voice. I believe that if your white counterpart and they see what's wrong, as it has been highlighted this evening, then they're just as complicit, and I would be having that conversation with them.
Thank you very much.
Yeah, and that's really important, because by being silent, not only are they being complicit, they could be seen as colluding, and they're actually encouraging the behaviour to persist because they're allowing the person to behave badly.
Yeah, I agree. Carl, you know of an organisation with Black therapists? Did I remember correctly?
Black, Asian, and Therapy Network.
Do you mind just, someone's asked a question about that. Do you mind just typing that into the chat for me? Thank you. Someone's asked, what's the best approach to begin this training? I think what they're trying to ask is, what's the best approach to addressing microaggressions with training? And their view is that many rush to this subject without building an environment for it or putting it into context for the long term. I think, Alfred, I think it goes back to our discussions around unconscious bias. And the fact that unless you actually put it into an overall strategy and you pursue that strategy for the right motives and consistently, and you bring individuals along with you and you listen to their learned experience, and you are genuinely, as an organization, as a leadership team, willing to engage with down to the grassroots for your staff, then any kind of training that is just put on for training's sake is likely to have more harm than do good. So yeah, I agree that you need to build the context and the environment to make consistent and meaningful change. Diane says, I think Diane, tell me if I'm wrong, but I think this is in response to discussions about white allies. I have the tendency to not say anything because I don't want them to feel that they have any impact on me or have one on me. Am I going about it wrong? So Diane, if you could just rephrase that question, because I'm not quite sure what you mean by it. Lady K said she recently raised the issue of microaggressions towards her, and the manager told the staff member, said the staff member is an excellent nurse. So because she's an excellent nurse, the matter will not go any further. Is it acceptable? The staff member now deals with me with avoidance. Well, the reality is that the organisation has a duty to provide a safe working environment for all its members of staff. It's also more likely than not have some kind of dignity at work statement. So I don't think it's necessarily 100% in the gift of any manager to say that this matter will not be taken any further without looking into your concerns meaningfully. So I think it's really over to you to determine how it impacts on you, how you want to take that forward. And if you want to kind of like suggest to your manager, can we at least begin, I'm willing to address this informally under the grievance or bullying harassment policy. So that's over to you to make a choice. Someone says, it looks to me like if people take the formal route, the outcome is no case to answer most of the time. Is it worth formalising complaints on microaggressions? I suppose, again, it's down to the individual and how it's impacted them. But I think using the framework that Carl's given and Joan's given, that will help individuals to really define and be able to articulate what the microaggressions were, how you felt about it, and giving specific factual examples. I think too often we can become far too emotional about what's happening to us. And it doesn't mean to say that there is not an emotional impact. What it means is actually the emotions actually cloud your thinking. It acts as an unhelpful filter. So look at what's happened to you in a very factual way, be able to discuss it in a factual way and write it down in a factual way, as well as how you felt and what resolution you are seeking. You're much more likely, and align your concerns with what the policy says. You're more likely to find your way much more smoother. I can't promise what the outcome will be, but I do know that the emotions are very helpful.
An example of that is when I dealt with the issue, I was on actually a leadership training at the time. And so when I I did a reflection and I sent it as an email to the facilitator of the program and copied in the chief exec and my line manager as well. And they got back to me straight away and asked me, what did I want to happen as a result? And I said, I would like to have equality and diversity training for all senior managers actually on this program. Because if I'm on a leadership program and nobody knows how to deal with it on this program, how are we going to be sorting this problem out in the future in the organizations that we work in? And as a result, they did bring somebody in. They did DeBono's 6 hats. I don't know if you heard of DeBono's 6 hats. And they did all this equality and diversity training for the senior managers that were on that program. So if I hadn't said anything, they wouldn't have got that training.
That's a really good point, to be able to identify what the problem is, but also be able to say, yes, I've identified this problem, but I also have some solutions here. So you have 1 or 2 solutions. It's very difficult for people not to address any kind of concerns, you know, if you bring a solution. So as well as being able to articulate what your concerns are, as well as being able to articulate what the problems are, also come with some suggested solutions. So I've got a comment here. As a passionate Black man, I'm constantly being taken as aggressive or uncooperative. I'm in my 60s and not much has changed. I have a high professional position. I have tried every angle, including what you are suggesting tonight. What else can I do? Do you want to answer that, Clark?
That is and if you've tried everything, then I think it is someone put in the chat around your union. If you're part of a union, then perhaps that is the route that you have to take. It is about being dogged in your determination of getting what you need. If you feel that there is, essentially we're talking about injustice here, because what we are talking about this evening is things that are not legal. They're not just. They're not fair. They are not legal, fair, and just. So as a result of that, what is your recourse? What are you prepared to do? Okay, because we know, we've talked about it this evening. Sometimes, as Dawn mentioned there, our emotional response. And what we have to remember is our feelings. And I hope you're able to capture this. Our feelings are not facts. Our feelings are not facts. So the thing is, if we have that emotional, response or connectedness to this issue, we won't be able to articulate what it is that we are seeing, what it is that we are witnessing, what it is that we are truly feeling. If it's not articulated in a way that they can understand it by really using their policies, using the policies that they have, and getting the proper people involved in the process. We have to, if we want to get change, we got to go the whole way.
And I think the thoughts that I've been having recently about this is that, you know, I think that there is a danger that individuals can look to organisations, institutions, government for change. Okay, from what I'm seeing, change is not happening at the pace I would like to see. If change was happening, and it was, even if it was slow, if it was meaningful change, I can be patient with it. But change isn't happening. And that's the choice of those in authority. The questions that I think that we've got to become more skilled at asking ourselves is, what are we prepared to change about ourselves? How are we prepared to transform? Because within all of this, we all have a choice. So it's important that we don't disempower ourselves. You don't disempower yourselves. If your organisation isn't treating you right and you've got skills, you've got abilities, scope out, research an organisation that, you know, does treat their employees correctly and consider applying there. As Joan said once to someone who had been in a particular job for over 10 years, was it, Joan?
In the same position, yeah.
In the same position, and she kept on applying for the next band up, and she didn't get it, and someone was lamenting about it on Twitter, and Joan said, "You're not a tree."
Go where you're celebrated. Don't stay where you're tolerated. Anytime you're denigrated, you will never be appreciated. And as I read somewhere as well, we are not trees rooted to the spot. So if they're not treating you well, they don't like you, go and find somewhere else to work. Or stop complaining, as Mayor Angelo would say. If you don't like something, change it. If you can't change it, change your attitude and stop complaining.
Okay. Okay, so
we've got 5 minutes left. Is it 5 minutes?
Literally to 2 questions. Thank you so much, but we're not going to get through all this, so I'm going to choose a couple questions. What are your thoughts on organisations gaming the system, i.e. setting up lots of space forums with little or no input? Do you want to go for that, Carl?
Could you say that again?
What are your views on organisations gaming the system? And basically gaming the system, setting up lots of safe space forums with little or no output.
Mm-hmm. Well, that's a whole theory right there. Games people play. Another tick box exercise to really satisfy the status quo. To say that they are doing something. Again, it comes to challenge. How if you don't challenge that particular way within the organization, it will remain the same. So I would challenge that. I mean, what is the purpose of this? Who is it benefiting? How are we, where's the evidence? I think I saw in the chat earlier about evidence-based programs. Where's the efficacy in what it is we're doing here? If it's not meeting the burden of proof, if this thing is still pervasive and persistent and it's still, insidious, then what is it? It's not fit for purpose.
Mm-hmm.
Thank you. And the last question, sorry. I'll take the last question, and is there an example of an ideal HR policy, how we know what is right or to be included? So I would also obviously read your organisation's HR policy and just pop onto the ACAS website. They are exemplars in good employment practice. So pop over to ACAS and they will say what should be in the policy and what shouldn't, as well as how you can deal with certain issues. And they write in very simple terms. Anybody can understand it. You do not need to be a HR professional. So I think that's come to the end of our discussion.
Can I say what I always say?
Yeah.
Okay, this is for everybody here. You are one of a kind, right from God's mind, or whatever you want to call him. You are a divine design. There's no one else like you on the face of this earth. You are not just one in a million, you're 1 in 7.4 billion. And if you were not here, the world would not be the same without you. You are here for a reason, just for a season, not for life. But while you have life, make sure you leave a legacy for life. And the only way to do that is to have a purpose, have a vision, have a dream, and fulfill it. Thank you.
Thank you. And I want to thank Carl and Joan. Because I call on them and they bring their expertise to bear because they want to serve people. And I've been off work for a few weeks, so I was so relieved when I spoke to Joan. And she'd already done so much work on this. So, I'm really appreciative of both of you. Going forward into the new year, if you would like us, we will be putting on events that will be paid ticketed events in the future. If you want us to cover a particular topic in depth, we will do that, but we actually need your suggestions. So if you can put your suggestions in the comments. If you have any queries or concerns, or queries really, just drop me an email. I'd like to thank you guys for taking time out of your evening to join us, and I really hope that you have been served well. So God bless all of you, and good night. And last thing, I'll send you the slides tomorrow.
Mm-hmm.